And you're welcome to unmute your mics and,
Yes.
speak with us or type in the chat box, whichever you prefer.
Here. And we can go through too and just do our spiel and take it from there as well.
Great, and it looks like we have Marissa joining us, and we do have a question in the chat box that we'll get to. So it's a question about move-in day and if things continue with the coronavirus and COVID-19. So I can share some information related to that as we go along. Cool. Go ahead.
Go ahead. All right. All right. Well, welcome everybody. This is Health and Wellness for Hartwick College Accepted Students Day. First, we're going to take a minute and introduce ourselves and show you, whoops, I keep going a little faster than I need to. My name is Heidi Tanner, and I am the Director of Health Promotion and Wellness here at Hartwick College, or actually officially Wellness and Health Promotion. My office really focuses on the education and outreach for all students throughout the year on health and wellness campaigns.
So I'm Amy Gardner. I am a nurse practitioner. I'm a graduate of Hartwick College, the class of 1999 in the nursing program. And I am the director of the Perla Health Center, the medical side. My side of our building focuses primarily on working with Heidi on activities with regard to how do we keep our campus community well. And then when people are not well, how do we work together to make sure that they are taken care of, addressing illness, injuries, testing, screening, and those type of things. We share our building with the Counseling Center, which is a great resource for students. And our Director of Counseling, Gary Robinson, is in charge of the mental health services for our campus. He has a staff of 3 full-time counselors in addition that work with him. And then we also have a psychiatric nurse practitioner who's available to help with mental health medication management for students who need that service, either because they're unable to have their home provider continue prescribing because they're crossing state lines, or because that provider, may want to see them more frequently, or because a new problem has developed while they are at college, and in working with our counseling center, they've decided that medication management might be an option. So we have a very collaborative relationship between medicine, counseling, and health promotion.
Yes. So these are just a few of the things that we offer. Again, the Office of Wellness and Health Promotion, which I'll talk about a little bit more in detail later on in the presentation. Again, our health center, our counseling center. But we also provide to all of our students free access to HealthiestU by Teladoc. And I'm going to let Amy talk a little bit more about that wonderful thing that we provide.
Yeah, so the HealthiestU program is a telemedicine service that we started using this year to help increase access for our students to healthcare, to help them service their healthcare needs. It is available to any student who's enrolled 24 hours a day, 365 days a year, whether they're on campus or whether they're away from campus. So that's one of the greatest benefits of that program. If the health center doesn't have an appointment available that meets your needs, if you have a need that develops at a time during our non-business hours, you have the opportunity to turn to that. And the other great thing about the current services that we have through the HealthiestU is that they are fully funded by the college. So there is no copayment, there's no charge to the actual student. So whether you use the service it's once, whether you use the service 5 times over the course of an academic year. There's no cost to you. It's not dependent upon insurance. It once you get registered, it connects you to a New York State physician, so that you're always speaking with a licensed medical professional, and they can address a pretty wide variety of items. Telehealth was definitely developing prior to all the changes in circumstances with coronavirus, but those services are expanding exponentially now, and so there's a lot that they can offer.
Yes. So next, we're going to kind of take each of the offices and kind of break it down just a little bit more about what you can expect and how students can access these great services.
So the first place is our health center on campus. As you enter the main gates, we are a standalone building. We're the first building on your right-hand side. And we have staff available in the building Monday through Friday from 9 till 5. We do see students by appointment, so we ask that the student calls ahead to let us know that they need an appointment. Typically speaking, we can get students scheduled within about 48 to 72 hours. We do try to reserve some same-day appointments, although they fill up rather quickly, so we encourage you, if you're in need of services, to definitely give a call first thing in the morning. If there's services that can be scheduled farther out, you certainly can schedule a week out or several days out to work around whatever your class schedule is or your other activities. And the same really holds true for our counseling center as well. They are open and see students by appointment during those same office hours. And the nice thing about our counselors, for emergency or urgent nature, there is one of our college counselors on call at all times. And those services would be accessed through the campus dispatch office by calling the switchboard. There's a brief triage process that happens, and then students can be connected with counselors for just a brief session, hopefully to minimize any concerns until they can actually get in for a full evaluation the next business day.
Then there's my office, the Office of Wellness and Health Promotion. And this is, again, as I mentioned, the office that's really responsible for education and outreach to all of our students on campus throughout the year. We really kind of look at and take to heart this wellness wheel that's on this slide, in that we really try to focus on all of our outreach really coming and stemming from the idea of one balancing their own personal wellness wheel. So our outreach can consist of Healthy Exam Week, where we encourage students to maybe consider not taking in so much caffeine to prepare for exams, but actually to get some good sleep and eat well. We promote nutrition, good nutrition and fitness. We also do a lot of substance misuse and abuse education, making sure our students have the facts. Really kind of whatever our students need, we tend to go out and make sure that we're doing. We're the home of the Peer Health Educators, which is a student group. They are basically work study students who work to identify, develop, create, and present different health and wellness information sessions all throughout campus throughout the school year. So that's kind of a summation of what we kind of tend to manage and do in this office. I'm also the person who is in charge of the Campbell Fitness Center, which is one of the 2 fitness centers on campus. And when that is open from 7 a.m. in the morning until 10 p.m. most evenings. And it's a great place for students to come and blow off some steam. We're going to be fully renovated this summer. We're getting a great facelift, and I'm very excited about that. I've been working very hard. So we're going to have kind of a brand new fitness center when students arrive sometime this fall. We're not exactly sure when that is, we know, but when we do, it'll be an exciting time.
So in terms of one of your first steps to prepare for arrival on campus is the completion of the college's health forms. So for those of you who are accepted students and who have made a deposit to come to Hartwick, somebody from my staff, either myself or my administrative assistant, has reached out to you over the past few days to reference our college health forms. And so you'll have the link directly to those forms in the email. If you're a student who's just considering Hartwick, you certainly can take a look at the health forms as well. They're posted on our webpage. And the health forms are a requirement, the information in them, in order to meet public health law. So we do encourage people to get those completed as quickly as possible. We set a deadline of July 15th because each of those forms that comes in is personally reviewed by a member of the healthcare staff to ensure that all the information is there, that it meets all of the requirements. If you're planning to participate on a college sport, there's particular information for that we want to make sure is in place so that we don't impact the start of your season because we're still looking for information. And for nursing majors, I know we have at least one potential nursing major. There is some very specific immunization information that needs to be completed. So the forms look daunting. There's 13 pages there. Some of that is information that we're required to provide. A lot of the forms, especially the first couple of pages, is personal information. It's information that you can fill in yourself. But it is important to note that there are certain pages of the forms that do require your healthcare provider's review and signature. So if you're planning on arriving at Hartwick, it's important that you have a plan in place to get those completed and signed off. We know that, this coming year, things are not going to be the norm. We'll consider that in terms of flexibility with dates and with, how we can get information. If you're having difficulty, especially getting immunization information, you can certainly check with your school, but you can also check with us, especially if you're from New York State or the New York City area, because we do have access to the immunization data banks, and a lot of times we can find information there if you're unable to get it from your provider's office. Nursing majors, Heidi has up one of the pages. It's our immunization page of our health forms. And so nursing majors, particularly important to pay attention, not only to the immunizations required for the college, but to the information in that box that's outlined in blue. Clinical facilities are very particular about what requirements have to be met before they will allow students to participate. And our nursing students do start participation at this current time right in the very first semester. We do require a physical within 12 months of the first day of classes for all new students. For athletes, that physical does have a deadline of within 6 months of first participation. So fall athletes, we want your physical to be within 6 months, ideally of the middle of August, 6 months prior to the middle of August. If you are a winter or a spring season athlete, you want to check with your coach in terms of what the anticipated first date of participation is. Although most spring sports have a fall off season, and so we look for 6 months within that first day of practice in the fall. And those are the last couple pages of the health forms. Again, if anybody has any questions directly related to the health forms, you're welcome to ask them at the end of our session today, or to reach out to me directly, and we can either set up a phone call or we can email back and forth, and I can, answer any specific questions that arise.
Jumped ahead, sorry. Do you want to talk a little bit about health insurance, Amy?
Sure.
And go ahead.
So I know that there was a question in the box regarding health insurance. So our College Health Center does not bill insurances. So if you've been trying to find out if your health insurance covers Hartwick College, we are not affiliated with any health insurance plans, and that's because we don't bill for the services directly that are provided within the health center. All students pay a set of fees, and part of those fees funds your ability to use the services of the health center, both the medical and the counseling services that are available. So to see a provider at the health center, there's no copay, there's no charge. There are some small additional convenience fees for specific testing that we might do within the health center, or if there is immunization or tuberculosis screening tests, for example, for someone who's doing a internship that we need to provide. And those fees will be explained to the student prior to whatever the test is being performed. And the student has the option of paying in cash, or we can add it to their student account bill, and it just becomes a line on that student account bill. We do ask people if we might need to send something off campus for processing. So let's say, for example, we think someone has strep throat, but the rapid test in the office is negative, and we want to send an additional specimen to the local lab. If that's the case, then the local hospital system, the Bassett healthcare system, would be billing your health insurance. And so that's where you want to know if you have coverage through the Bassett healthcare network. And I think the other thing that's on this slide is just medical accommodations. So if students do have special needs, we ask that over that summer prior to beginning, that you reach out to us at the health center so that we can discuss what those needs are and how best we can accommodate each individual student. We work with our residential life staff, we work with the dining hall staff, we work with the staff in the Center for Student Success. And so because each individual circumstances are different, it's easier to address those accommodations directly with each family.
Last but not least, we are happy to take any extra questions. If anyone has any, and I'm gonna go ahead and I'll unmute everybody because I don't feel like we have a super big group, so feel free to just ask your question, or if you are more comfortable typing it into the chat box, we're monitoring that as well.
So I'll start with one of the questions that was typed initially into the chat box. And it's a question about kind of the great unknown. So if the coronavirus outbreak continues, how would we be proceeding with moving day? And the answer to that right now is we don't have a definitive answer. Our college has a strategic response task force, which is diving deeply into that topic right now, considering what the governmental regulations will be, what type of things our campus can accommodate in terms of helping students to maintain social distancing, not only in the classroom setting, but most importantly in that residential setting where you're going to be living and dining. And so we are hoping to come up with a very solid plan for that, that takes into consideration all of the restrictions which may or may not still be in place when moving day starts, and in general everyone's health and wellness, and how that incorporates with helping students to become connected to campus and have the best learning opportunity under the circumstances possible. And you'll see much more information coming forth on that once we know more and as plans start to develop. as we go down, let's see, I think I addressed the insurance question, but if you do have further questions about your insurance, definitely reach out to my email. And specific questions about nursing. Anybody? And that for now, I believe, were the questions in the chat box. I will say that nursing, the nursing program is an amazing program. It's a program that will challenge your mind. It will challenge you to think differently, to think very critically, but it will also allow you to enter the nursing workforce very well prepared. Our students participate in a lot of clinical hours. We have a state-of-the-art simulation lab, and that's one of the things that has allowed our nursing students to continue to finish off their semester, this spring semester with all of the changes. We were able to work with the New York State Department of Health and using a combination of Zoom type sessions such as this in our simulation lab. All of our students are going to be able to complete their clinical requirements and be ready for graduation. A question related to COVID and limited appointments with doctors: is the July 15th deadline set, or is there flexibility? I think this is a time when there has to be flexibility. You know, the current requirement is that every requirement is perfectly met 30 days from when classes start. So we do have a little bit of time to work, but I anticipate that there will be some flexibility even beyond that. I think the most important thing that I would suggest is, if you are in need to schedule a physical, because that really is the piece that comes into play with that July 15th deadline. If you can at least try to get an appointment scheduled for July or August, and if that appointment needs to be moved, then we will continue to work with students individually as long as they have a plan to move things forward. Other questions? So we're such a small group. I don't know if any of you are willing or interested in sharing where you're from, if you're a senior anticipating coming to Hartwick this fall, or any information about you that would help us to think about other questions that might come to mind.
And while you're thinking about that, I can share with you that this week, even though we are all separated from our beloved Hartwick campus, the peer health educators are actually putting on a Narcan training event this week virtually, which is kind of interesting that we're doing some different kind of outreach. And they're also going to be hosting a mind share night coming up in a couple weeks to just get students together to kind of talk about the strategies they're employing for self-care while they're away in the areas of mental health, nutrition, and staying connected. So a question just popped into the chat, Amy. Health and wellness. Are meals included within the fee? Do you know that breakdown?
I believe that meals are actually part of the room and board portion of the billing. So they're in terms of the, the general cost of Hartwick. There's the tuition and fees, and fees, tend to cover, I believe, like support from information technology, resources in the library, health services, counseling services, health promotion, and the use of the fitness centers. And then room and board would cover your res hall room and the meals. The Commons has an unlimited dining plan. So that's the plan that most students have their first year on campus, and that allows access to the dining hall anytime it's open, whether you're dropping in just to get a quick snack, or whether you're joining friends to sit down and have a full dining meal experience. Devin White, our director of Aramark and Dining, puts together some amazing menus, some specialty programs several times a year, and really does a nice job. And Shayna, who's on the line supporting us from admissions, did include in the chat box a link that allows you can follow to actually see the meal plan options that are available. Thanks, Shayna. Any other questions, whether they're directly related to health and wellness, the health center, or related to Hartwick that anyone might have? If we have the information, we'd be happy to share it with you. And if we don't have the information, we'll do our best to direct you to the people who do have that information.
Yes. And if you find that on Tuesday you have some additional questions, our email addresses are here on this slide for you, and they're also easily found on our website. If you type in health and wellness, we will all populate and pop up. So feel free to email us too after the fact if you find that you have additional questions. We're happy to help. Well, Amy, it doesn't look like anybody has any other questions for us today.
I see that.
So we can give everybody 10 minutes back in their day.
There's nothing wrong with that.
Always a nice treat to have that.
Yes, it is.
So just take a glance. Our email addresses are pretty easy. They're our last name and our first initial at hartwick.edu. So don't hesitate to email us or your friends in admissions. We're all happy to help you launch here at Hartwick in the fall.
Great. Sounds good.
All right.
Have a great day, everybody.
Yeah, everybody have a great day. Take care, everyone. Go ahead. Share. Sheena said, thank you. All right, cool. It's just down to us. I will stop recording.
As I say.